There's a sleeping position that millions of people over 60 use every night without knowing it's silently robbing them of their health. And I'm not exaggerating. This position may be causing you back pain, elevated blood pressure, breathing difficulties, and even increasing your risk of suffering a stroke while you sleep. What's most concerning is that all of this happens without you realizing it. While you think you're resting, your body is suffering. And you know what's the worst part? You've probably been sleeping like this for years, maybe your whole life. Let me ask you a very direct question. Do you wake up in the mornings with neck or lower back pain? Do you feel tingling in your hands or feet during the night? Do you struggle to breathe well or wake up with a feeling of suffocation? Do you snore more than normal, or has your partner told you that you stop breathing at times? If you answered yes to any of these questions, I want you to pay close attention to what I'm going to tell you today, because the problem might not be in your mattress, nor in your pillow, nor in any hidden disease. The problem could simply be in the way you sleep, and the good news is that it has a solution, a simple solution you can apply starting tonight. But before revealing which dangerous position that is and how to correct it, I need to explain something fundamental. I'm Dr. Cezar Villarreal, a physician specializing in internal medicine and senior health. I've spent more than 18 years treating patients in clinics, hospitals, and centers specialized in healthy aging. Throughout my career, I've seen everything. People who arrived with chronic pain that nobody could explain, patients with circulation problems that didn't improve with medications, people who felt exhausted despite sleeping 8 hours or more. And in many of those cases, do you know what the source of the problem was? It wasn't the heart, it wasn't the lungs, it wasn't any serious disease. It was the posture they slept in. Seems incredible, right? Something as simple as the way we position our body during the night can make the difference between truly resting or waking up worse than when we went to bed. I remember perfectly the day I began investigating this topic in depth. It was a few years ago when I noticed a pattern that repeated in my practice. Patients aged 60, 65, 70 who arrived with the same symptoms: lumbar pain, tingling, extreme fatigue, problems breathing well, and almost all had something in common. They slept in positions that were damaging their body without them knowing it. Since then, I've dedicated hundreds of hours to studying the relationship between sleeping posture and health and maturity. I've read research from universities around the world. I've consulted with colleagues specializing in orthopedics, cardiology, and neurology, and I've applied all that knowledge with my own patients. The results have been surprising, and today I want to share with you everything I've learned. But before getting into the solutions, I need you to understand why this topic is so important after 60. Because sleeping poorly at 30 is not the same as sleeping poorly at 65. The body changes, and those changes have direct consequences on how posture affects us during the night. Let me explain what happens. As we age, the body produces less melatonin, which is the hormone responsible for regulating the sleep cycle. This means it's harder for us to fall asleep, and we spend less time in the deep phases of rest. Those deep phases are what allow the body to repair itself, the brain to process the day's information, and cells to regenerate. When we don't reach those deep phases, sleep becomes superficial. We wake up several times during the night. We feel the need to go to the bathroom frequently. And although we spend 8 hours in bed, we wake up as if we hadn't rested at all. But that's not all. After 60, problems like osteoarthritis, herniated discs, nerve pain, and muscle stiffness also appear more frequently. The body seeks positions that relieve those discomforts, and many times, without realizing it, we end up adopting postures that actually worsen the situation. And here comes the most concerning part. When sleep is already more fragile due to age, poor posture can have much more serious effects than before. What do I mean by this? Imagine you sleep in a position that compresses your chest. At 30, you probably wouldn't notice anything. But after 60, that compression can make breathing difficult, reduce blood oxygenation, and increase pressure on the heart. All this while you sleep, without you realizing it. Or imagine you sleep in a position that presses your neck to one side. At 30, you might wake up with a small discomfort that disappears in a few hours. But after 60, that constant pressure can affect circulation to the brain, cause chronic pain, and even increase the risk of serious neurological problems. Do you begin to see why this is so important? Sleeping poorly is not just resting less. Sleeping poorly, especially in an inadequate posture, can affect your heart, your lungs, your spine, your circulation, and even your brain. And the worst part is that many people think it's normal to feel this way with age, but it's not. I've had patients who arrived resigned. They told me, "Doctor, I'm already 70. It's normal that everything hurts." And when I explained that a large part of their problems came from how they slept and taught them to correct it, their life changed completely. Mr. Arturo, 68 years old, is a perfect example. He came to my office dragging back pain he'd been unsuccessfully treating for years. He tried physical therapy, medications. They'd even suggested surgery. When I asked him how he slept, he told me always face down since he was young. I explained the risks of that position and gave him some simple indications to change it. In less than a month, the pain had decreased 70%. No medications, no surgery, just changing the way he slept. I see cases like Mr. Arturo's constantly. That's why I decided to make this video, so you can also benefit from this information. Before continuing, I want to pause and ask you something. Do you identify with what I'm describing? Do you wake up with pains you can't explain? Do you feel you don't rest well, even though you spend all night in bed? If so, I want you to know something very important. You are not alone. Thousands of people who watch this channel are going through exactly what you're going through, and many of them have found here information that has changed their life for the better. I'd love to know where you're watching me from today. Write me here in the comments with your city or country. It always excites me to discover how far this community that grows every day reaches. And if you think this topic is important, if you know someone who's been sleeping poorly for a while or who complains of pain upon waking, I ask you to give this video a like. That simple gesture helps YouTube show this content to more people who need to hear it. I also invite you to subscribe to the channel and activate the notification bell. Every week, I share clear, practical, evidence-based medical information to help you live with more health, more energy, and better quality of life, especially in this stage of maturity. Because taking care of your health isn't just a doctor's job. It's a decision you make every day. And I'm here to accompany you on that path. Now, yes, let's get to what you came for. I'm going to reveal which is the most dangerous position to sleep after 60 years old. What I'm about to explain is information I normally only share in private consultation with my patients. But today I want to give it to you too, because I believe it can completely change the way you rest. We're going to talk about several fundamental points. First, I'm going to reveal exactly which is the most dangerous position to sleep when you're over 60 and why it causes so much damage to the body. Then I'm going to explain what happens inside your body when you sleep in that position. You'll understand exactly which organs are affected and how. Next, I'm going to show you which is the safest and healthiest position to sleep in maturity, backed by international medical studies. And finally, I'm going to give you practical and simple tips so you can change your posture gradually without discomfort and start noticing improvements from the first nights. But I want to ask you something. Pay special attention when we talk about the recommended position and pillow adjustments. Although it may seem like a minor detail, it's exactly what makes the difference between my patients who improve and those who continue suffering. Why? Because it's not just about sleeping on your side or not sleeping face down. It's about how to correctly align the body so each organ functions as it should during the night. Are you ready? Then let's begin with the most important revelation of this video. Number, the most dangerous position, sleeping face down. I'm going to say it clearly. The most dangerous position to sleep after 60 is face down. I know many people find this position comfortable. In fact, it's estimated that nearly 16% of adults habitually sleep in this posture. And when you're young, the body can tolerate certain tensions without major consequences. But after 60, sleeping face down can become a real health problem. Why is this position so dangerous? Let me explain point by point. First, pressure on the spine. When you lie face down, the natural curvature of your back flattens or even inverts. Throughout the night, the spine remains in an unnatural position that generates tension in the intervertebral discs, muscles, and ligaments. Upon waking, that tension translates into lumbar pain, stiffness, and discomfort that can last all day. Second, neck torsion. To be able to breathe when you're face down, you need to turn your head to one side. This means you spend hours with your neck rotated in an extreme position. The cervical muscles tense, the vertebrae compress unevenly, and nerves can become pressed. The result: neck pain, torticollis, tingling in the arms, and even chronic headaches. Third, compression of the chest and lungs. When you're face down, all the body's weight falls on the thorax. This makes lung expansion difficult and reduces respiratory capacity. For a person over 60, especially if they have any previous respiratory problem like asthma, COPD, or sleep apnea, this compression can be particularly harmful. Blood oxygenation decreases, the heart has to work harder, and rest becomes superficial and insufficient. Fourth, pressure on internal organs. The liver, stomach, intestines, and other abdominal organs become compressed when we sleep face down. This can worsen digestive problems, increase gastroesophageal reflux, and hinder intestinal transit. Many of my patients with nighttime digestive problems improve significantly just by changing this position. And fifth, something few mention, pressure on the face. Sleeping with your face flattened against the pillow for hours can aggravate wrinkles, cause facial swelling, and in more serious cases, affect blood circulation in the area. I remember Mr. Ernesto, a 72-year-old patient who came to my office desperate. He'd had unbearable pain in his right shoulder for months that wouldn't yield to anything. They'd already done x-rays, MRIs, prescribed anti-inflammatories, and muscle relaxants. Nothing worked. When I asked him how he slept, he told me always face down, with his right arm under the pillow. I explained that position was compressing the nerves and tendons of his shoulder for hours every night. It was as if they were pressing his shoulder for 8 straight hours every day. I gave him indications to gradually change his posture. In 3 weeks, the pain had almost completely disappeared. Mr. Ernesto couldn't believe the solution was so simple. But here comes an important question. If sleeping face down is so bad, what about sleeping face up? Sleeping face up. Better, but with precautions. Sleeping face up is, without doubt, better than sleeping face down. In this position, the spine can maintain a more natural alignment, the neck doesn't need to turn, and there's no direct pressure on internal organs. However, for people over 60, sleeping face up also has its risks, and these risks can be serious. The main problem is sleep apnea. When we sleep face up, gravity causes the tongue and soft tissues of the throat to fall backward, narrowing the airways. And people who are overweight, have a small jaw, or have throat musculature weakened by age, this can cause apnea episodes. That is, moments when we literally stop breathing for seconds or even minutes. Sleep apnea is much more common than people think. It's estimated to affect more than 20% of people over 60, and many don't even know it. Symptoms include loud snoring, frequent awakenings, nighttime choking sensation, extreme daytime fatigue, and morning headache. But what's most concerning is that untreated sleep apnea significantly increases the risk of hypertension, heart disease, stroke, and even cognitive problems. Additionally, sleeping face up can worsen gastroesophageal reflux. When we're in a horizontal position without any incline, stomach contents can rise more easily toward the esophagus, causing acidity, burning, and that uncomfortable feeling of having something stuck in the throat. So if face down is dangerous and face up has important risks, what's the ideal position? This is exactly what you need to know. The safest position, sleeping on your side, left lateral. The answer is backed by medical studies from around the world. The safest and healthiest position to sleep after 60 is on your side, preferably on the left side. This position, known in medical terms as left lateral decubitus, offers multiple benefits that I'm going to explain in detail. First, it improves blood circulation. When you sleep on your left side, you facilitate blood return to the heart through the inferior vena cava. This reduces the load on the cardiovascular system and is especially beneficial for people with circulation problems, leg swelling, or heart failure. Second, it favors breathing. When sleeping on your side, throat tissues don't collapse backward as happens face up. Airways remain more open, which reduces snoring and apnea episodes. Lungs can expand more freely, and nighttime oxygenation improves significantly. Third, it protects the spine. With adequate support, which I'll explain how to achieve, the lateral position allows the spine to remain naturally aligned. This reduces pressure on intervertebral discs and prevents back, neck, and shoulder pain. Fourth, it aids digestion. The stomach and pancreas are located in such a way that when sleeping on the left side, gravity favors the digestive process. Gastric emptying is facilitated and reflux is significantly reduced. For people with nighttime digestive problems, this change can be transformative. Fifth, it benefits the brain. Recent studies have shown that sleeping on your side favors the glymphatic system, which is the mechanism the brain uses to eliminate toxins and metabolic waste during the night. It's believed this brain cleaning process could be related to preventing neurodegenerative diseases. Mrs. Margarita, 71 years old, is one of my most memorable cases. She suffered from severe reflux that woke her several times each night with a choking sensation and burning in her chest. She tried all kinds of medications with mediocre results. When I suggested she change her sleeping position to the left side and slightly elevate the head of the bed, the results were impressive. In 2 weeks, her nighttime reflux episodes reduced by more than 80%. But careful, it's not enough to simply lie on your side. To get all these benefits, you need to do it correctly. How to sleep on your side correctly. Essential adjustments. This is where most people fail. They know they should sleep on their side, but they don't do it correctly and end up with pains or discomforts that make them return to their old postures. I'm going to give you the keys to doing it right. First key, the pillow for your head. You need a pillow that keeps your neck in a neutral position that is aligned with the rest of your spine. If the pillow is too high, the neck bends upward. If it's too low, it bends downward. Both situations generate muscle tension and pain. The ideal height depends on the width of your shoulders. The wider they are, the higher the pillow should be. Cervical or anatomical pillows are usually an excellent option. Second key, the pillow between your knees. This is perhaps the most important advice and the one most frequently ignored. When you sleep on your side without any support between your legs, the upper knee falls downward and rotates the hip. This rotation generates a twist in the lumbar spine that's maintained for hours. The result, lower back and hip pain upon waking. Placing a pillow between your knees keeps your hips aligned and eliminates that twist. The difference is noticeable from the first night. Third key, lumbar support. If you notice there's a space between your waist and the mattress, when you're on your side, you can place a rolled towel or small pillow to fill that gap. This supports the natural curvature of the spine and prevents it from sinking. Fourth key, arm position. Avoid sleeping with your arm under the pillow or head. This position compresses nerves and blood vessels, causing tingling, numbness, and pain. Ideally, keep your arms relaxed in front of your body, perhaps hugging a soft pillow. Fifth key, the right mattress. A mattress that's too soft allows the body to sink, losing alignment. One that's too hard doesn't adapt to the body's curves and creates pressure points. Ideal is a medium firm mattress that offers support but also some adaptability. Memory foam mattresses or those with differentiated zones usually work very well for side sleeping. Mr. Roberto, 67 years old, told me he tried sleeping on his side but always ended up returning to face down because his shoulder hurt. When we reviewed his situation, we discovered he used a flat pillow that didn't give him the necessary cervical support and that he didn't put anything between his knees. I recommended he make these adjustments, and now he sleeps comfortably on his side all night without pain and without returning to his old posture. The gradual transition. How to change posture without suffering. I know what you're thinking, doctor. I've been sleeping the same way for decades. How am I going to change now? It's a valid concern. Sleep habits are deeply rooted, and changing them abruptly can be difficult and even counterproductive. That's why I want to give you some strategies to make this transition gradually and comfortably. First strategy, the barrier pillow method. If you're used to sleeping face down, place a pillow on your back before falling asleep on your side. This pillow acts as a physical reminder that prevents you from rolling to the face down position during the night. Over time, your body will get used to the new position and you can do without the barrier. Second strategy, progressive change. Don't try to go from face down to left side abruptly. First, try sleeping face up for a week or two. Then introduce the lateral position gradually, alternating nights. Your body needs time to adapt. Third strategy, environment preparation. Before going to bed, make sure you have all necessary pillows prepared and in place. If you have to look for them in the middle of the night, you probably won't do it and will return to your usual posture. Fourth strategy, prior relaxation. A tense body tends to seek defensive positions that are often the least healthy. Before sleeping, do some gentle stretches, especially of neck, shoulders, and lower back. A warm bath can also help relax muscles and facilitate adopting the new posture. Fifth strategy, patience. Don't be discouraged if the first nights are difficult or if you wake up having returned to your previous position. Changing habits takes time. What's important is consistency. With each night you try, your body will adapt more. If you've gotten this far, congratulations. You now know more about sleeping posture than 90% of people, and that information can protect you from serious health problems. But before finishing, there's something else I need to tell you, something many doctors don't mention, and that can sabotage all the benefits of sleeping in the correct position. I'm talking about the most common mistakes people make when trying to improve their sleep. Mistakes that unknowingly may be nullifying all the effort you make to sleep better. And I also want to talk to you about special situations, because I know many of you have particular conditions, chronic pain, arthritis, mobility problems, recent surgeries, and you need specific adaptations that aren't the same for everyone. This information is what I normally reserve for my private consultations, but today I want to share it with you because I know it can make a real difference in your quality of life. So I ask you to stay with me a few more minutes. What comes next may be exactly what you need to hear. And before continuing, if this information is proving useful, I invite you to leave a comment telling me how you sleep. Face down, face up, on your side? I'd love to know your experience and be able to guide you more personally. Comments also help me understand what topics interest you most for future videos. Now, yes, let's go with the mistakes you must avoid at all costs. The 5 most common mistakes. Mistake number 1, using too many pillows. Many people think more pillows means more comfort, but excess can raise the head too much, flex the neck unnaturally, and make breathing difficult. 1 or 2 well-positioned pillows are sufficient. Mistake number 2, ignoring the bedroom environment. You can have the perfect position, but if your room is too hot, with too much light or noise, your sleep will be poor quality anyway. The ideal temperature for sleeping is between 18 and 21 degrees Celsius, 64-70 degrees Fahrenheit. The room should be dark and quiet. Mistake number 3, constantly changing position during the night. Some movement is normal and healthy, but if you wake up multiple times to reposition yourself, something isn't right. It usually means there's some discomfort your body is trying to relieve. It could be the mattress, the pillow, or some muscle tension that needs attention. Mistake number 4, not giving the change time. Many people try sleeping on their side for a night or two, don't feel comfortable immediately, and give up. But the body needs at least 2 or 3 weeks to adapt to a new sleep posture. Persistence is key. Mistake number 5, ignoring pain. If when sleeping on your side you feel pain in your shoulder, hip, or any other area, don't ignore it. That pain is a signal that something isn't well aligned or that you need more support in that area. Adjust pillows, check the mattress, or consult with a professional. For people with arthritis in shoulders or hips, it's essential to use extra pillows to protect affected joints. A soft pillow under the hurting shoulder can significantly reduce pressure. If arthritis is very severe on one side, consider sleeping on the less affected side. For people with lower back pain or sciatica, the lateral position with pillow between knees is especially important. It can also help to slightly flex the knees toward the chest in an almost fetal position to open the space between lumbar vertebrae. For people with respiratory problems, in addition to sleeping on your side, consider slightly elevating the head of the bed, about 10 to 15 degrees. This facilitates breathing and reduces nighttime nasal congestion. For people with reduced mobility, consider adapting the bed with safety rails, low friction sheets that facilitate movements, and make sure the bed height allows sitting and getting up easily. Mrs. Josephina, 76 years old, had limited mobility after a hip operation. She woke up multiple times because she couldn't reposition herself alone. We adapted her bed with smooth satin sheets, strategically placed pillows, and a side rail. These simple modifications gave her back nights of continuous rest. We've talked about the most dangerous sleeping position, the safest position, how to make the transition correctly, and the mistakes you should avoid. But there's something we haven't touched on that's equally important. Did you know there are certain foods that, if you consume them before sleeping, can completely ruin your rest? It doesn't matter if you sleep in the perfect position. If you dine poorly, your sleep will be poor quality. And conversely, there are foods that can help you sleep better, deeper, and wake up with more energy. In my next video, I'm going to talk to you exactly about that. I'm going to reveal which foods you should avoid at dinner if you're over 60, and which are the best to promote restorative sleep. Believe me, this information will surprise you, because some of the foods many consider healthy are actually enemies of good rest. I'm also going to talk to you about beverages, because it's not just what you eat, but what you drink that may be sabotaging your nights. And I'm going to share with you a simple recipe that many of my patients prepare every night before sleeping, and that has greatly helped them fall asleep faster and wake up less during the night. That video is almost ready, so make sure you're subscribed to the channel and have the bell activated so you don't miss it. I promise it will perfectly complement everything you learned today. Because sleeping well doesn't depend on a single factor. It depends on position, yes, but also on nutrition, environment, pre-sleep habits, and many other elements we'll be covering in this series. Your rest is too important to leave to chance. If you've gotten this far, I want to sincerely thank you, not just for your time, but for your commitment to your own health. The information I've shared with you today may seem simple. Change your sleeping position, you might think. But now you know that behind that simple change are enormous benefits for your heart, lungs, spine, circulation, and even your brain. Sleeping face down after 60 isn't just uncomfortable, it's a real risk to your health. And most importantly, it's an avoidable risk. Now you have the knowledge. Now you have the tools. All that's left is for you to take action. Tonight, when you go to bed, remember what we've talked about. Prepare your pillows. Lie on your left side. Place the support between your knees. And give your body the chance to rest as it deserves. The first nights may be strange. It may be hard to adapt, but I promise that with a little patience and consistency, you'll notice the difference. You'll wake up with less pain. You'll feel more rested, and your body will thank you. Before saying goodbye, I have 3 requests for you. First, give this video a like if you found the information useful. That simple click helps more people find this content and benefit too. Second, share this video with someone who needs it. It could be your partner, an older family member, a friend who complains of pain upon waking. Sometimes a shared video can change someone's life. Third, subscribe to the channel and activate the bell if you haven't already. There's much more valuable information to come, and I don't want you to miss it. I'm Dr. Cezar Villarreal, and this is not goodbye. It's see you in the next video. Take good care of yourself, rest well, and always remember, your health is in your hands, even while you sleep. See you very soon.